Whether you're a young athlete on a sports team or you play sports on your own free time, you know that it's all too well and easy that sports injuries go hand in hand, literally. And as we get older, the effects of sports injuries can linger in the form of arthritis and joint pain. My first guest is here to explain that you don't have to live with the pain. Joining me to discuss his practices and approach to sports injuries is Dr. Raymond Kobus with Hand and Microsurgery Associates. Dr. Kobus, nice to have you here.
Good morning.
It is interesting as we get older how all of a sudden when we wake up we have a lot more aches and pains in our joints, and that's to be expected, right?
You don't even have to have an injury. Sometimes you just wake up and say, well, where did that discomfort come from? I don't remember having that yesterday. But as you get older, these things happen. We take care of a lot of folks from very young to older. A lot of folks trying to stay in shape have repetitive use injuries, and a lot of younger people have injuries from sports that they just get hit by a ball in their hand or have a sprain or a contusion of their hand. And so we take care of the range of athletes from very young to very old.
So just because you have arthritis and you have a little bit of pain doesn't necessarily mean that you need to see, somebody needs to see you. What are some signs that they don't have to live with that much pain and it should be time to check it out?
Well, things that are recurring daily, such as when you do a repetitive type activity, even keyboard activities or athletic activities where you're working out or running, if you're having discomfort, that's usually a key that maybe something can be done to kind of alleviate that discomfort and make it easier for you to participate in what you want to do.
And back to kids and sports or those weekend sport athletes, what is your approach to treating sport injuries?
Well, we usually will see folks within 24 hours if they have an acute injury, such as an athlete who's participating in football or basketball or baseball. And we have the capabilities to do x-rays and complete evaluations, and so it's something that we can see the patients actually first at our office as opposed to having to wait at an urgent care or an emergency department.
So they can go straight to you?
Exactly, and we have all the facilities there to kind of take care of things, and in general most insurances cover all of the visits to our office just like they would an emergency department.
And it's funny how we never think how much we use our hands, but you hurt one, there's an injury, and all of a sudden, wow, your whole life is tied up.
Exactly. You use your hands daily to do activities of daily living. And
one of those things we take for granted.
Exactly. And so a lot of times we'll see people who are actually having a significant hardship in doing activities that they normally would like to do, such as sports activities or even daily living activities. We have various facilities such as therapy. It's not always something that requires surgery. Many of these injuries are treated non-surgically. We have a variety of custom braces. You don't have to go into a white cast. You can have sort of a little fun thing while you're recuperating from your injury.
Why don't some need to have surgery, doctor? Is it because if there's no broken bone and it's more arthritis or muscle tendon type stuff that you can work with without any surgery?
Yeah, we generally try a conservative approach initially. Therapy, medications, and even sometimes cortisone injections for older athletes who have problems with tendonitis. But I would say in the vast majority of people who have athletic injuries that are repetitive in nature don't require surgery. They do require therapy and just other forms of treatment.
And if you use a brace like this, sometimes will that brace in itself be the answer without having to have a cast, without having to undergo surgery, and sometimes just that will be work?
Sometimes just immobilization. And again, the immobilization with casting was traditional in the 60s and 70s, and removable type bracing and casts have become much more popular now, and it's gotten to the point where we have these type of braces that are washable, they're reusable, and you know, they don't look like they're so punitive as far as a medical treatment.
I remember that broken bone I had on my wrist when I was in 6th grade, and that, when you talk about it itched and all those things that you couldn't take it off, you couldn't wash. You're right, that was like eons ago.
Right.
But wow, how much better if you could do some daily activities just a little bit and then put the brace back on.
Absolutely.
Do you treat a lot of young people, doctor? What's the average age range?
We actually have age range from very young, I would say 2 to 3 years old, up until, you know, Medicare age in the 70s, 80s, and 90s. But we do see a lot of young athletes, and most of the time young athletes are actually coming in not so much with repetitive type tendonitis problems, but with acute injuries. Their finger has been hit by a ball or their wrist has been jammed when they've fallen on it in doing athletic activities.
Well, one of the reasons I ask is because younger kids, and I guess anyone really, you have a new MRI system that will help some folks who really have that claustrophobic feeling. So yours is, do you call it a more open type of MRI?
It is an open MRI, and MRI scanning is sort of a specialized technique where we're actually looking at the bone but also the soft tissues, because many athletic injuries involve the soft tissues, sprains, strains,
It looks so much
ligament
easier
tears.
and more comfortable.
And it's not a machine that you have to sit in, and again, you're right, some people get very claustrophobic when they're in a closed space. This is something you just put your extremity in and we can scan the hand, fingers, wrist, elbow, up into the area of the forearm.
Sounds so much easier. Well, Dr. Kobus, your phone number and website have been on the air, so we know if folks want to get in touch with you, they can.
Thanks very much. Thanks for having me.